good evening everyone. Welcome to OET Speaking Speculation. This is me, Richard Caroline, joining you from Nidus Academy, and today I'm here with Emmy. So, we are back with another mock test presentation for you guys, and we have picked a very latest exam model card as well. And in the context, we are dealing with a patient who is already admitted in the hospital. He sustained a fracture from a fall, and you are discussing the aftercare management, like discharge ആവുകയാണ്. ആ ഡീറ്റെയിൽസ് നമ്മുടെ കാർഡിൽ എടുത്ത് പറയുന്നില്ലെങ്കിലും it is given that you're there to discuss how to manage the things and how to take care of himself. So obviously ഇങ്ങനത്തെ കേസസ് വരും നമ്മൾ പലപ്പോഴും കണ്ടിട്ടുള്ളതാണ്. പേഷ്യൻറ്റിന് കുറേ ക്വസ്റ്റ്യൻസ് ഉണ്ടാവും, കുറേ കൺസേൺസ് ഉണ്ടാവും. അപ്പോൾ ആ കൺസേൺസും ക്വയറീസും ഒക്കെ നമ്മൾ അഡ്രസ്സ് ചെയ്തിട്ട് അതിനുശേഷം എങ്ങനെയാണ് വൈൻഡപ്പ് ചെയ്യേണ്ടത് കാര്യങ്ങളൊക്കെയാണ് നമ്മൾ എൻറ്റയർ ഒരു കാർഡിൽ വന്നിരിക്കുന്നത്. സോ ദിസ് ഈസ് ഹൗ ദിസ് എൻറ്റയർ കാർഡ് ഹാസ് ബീൻ ഗിവൻ ഹിയർ. സോ ഇന്നത്തെ മോക്ക് ടെസ്റ്റിൽ I'll be playing the part of the nurse and Amy will be doing the part of the interlocutor. So without wasting much time, let's get started. Okay? Yes. All right, Amy, you ready?
Yes. So shall we start?
Yeah.
Okay. This is the card.
Thank
and
you.
You have 3 minutes to prepare. Your time starts now.
Thank you.
Okay. So your time is up. Right now we have 5 minutes to speak and your time starts now.
Okay. Good evening.
Good evening.
My name is Richa. I'm one of the registered nurses working in this orthopedic ward. For the verification, can you please state your name and age?
My name is George and I'm 27.
All right, George. So I have been advised by your doctor to come and talk to you regarding your pre-discharge details and how to manage your present situation. And from your report, I can see that you sustained fractured leg in a fall. Yes.
Yes.
All right. So how do you feel right now?
If I have to be honest, it is so frustrating. I would say, because I'm in severe pain. I don't know what to do. I'm really tired with all this.
I totally understand how difficult the situation is for you. So if it gives you any peace of mind, all I can say is bone healing has to be natural, okay? And it can take some time, so please be patient. We are doing everything, and your recovery is looking just as fine as expected as well. And please always remember this, your body has got a lot of amazing ability to repair itself. So please be patient, and the difficulties you're experiencing right now will be subsided as time goes on. Okay, so please don't worry about it.
Okay.
So George, do you have any questions to ask me?
No, it's like botheration. Like one thing that I'm really bothered about is the cast. It is so itchy. Do I actually have to put that on?
Well, this is a question I hear from almost all the patients who have to wear a cast. So I totally understand where this is coming from. Given your situation, it is imperative that you wear the cast. I can explain why. Because it is important that you are immobilized or you're not having much movement in that area. You need a support for a proper healing there. And also it will help to keep your bone aligned. And it will also help to prevent further injury. So it is very important and crucial that you have this cast worn all the time until the doctor's advice, so that it can help you for a better recovery. I hope you understand.
Yeah, I understand, and I understand that I can't live without it now, right?
Well, I totally understand that, but please understand it is important that you need to wear it, okay?
I get it, yeah.
Speaking of that, I would also like to bring to your attention, it is important that you maintain proper hygiene and personal care when you're wearing this cast. And it is important that you keep it dry. And since you told me you feel itchy, there will be the urge to put anything inside to itch it or scratch it. So please refrain from doing that. Do not stick anything inside.
Okay.
And George, it is important that you look out for any sign of skin breakdown. Some people can get this rashes or this itchiness and things like that. So please make sure that you look out for any of these things. And if anything comes to your attention, please inform us at the earliest. Okay. Having said that, I would like to talk to you about the pain management options, because you told me that you are experiencing pain. So the doctor has prescribed some pain medication for you, so please continue with it. And you can apply some ice packs, and you can keep your leg elevated. So all these measures will definitely help you to feel better, and it will also ease your pain to an extent. Okay. And there are other strategies like gentle movements for you to your toe, and relaxation techniques can also help you to ease the pain. The hospital physiotherapist will be seeing you shortly before your discharge to discuss what are the general exercises that you can do to ease the pain, and also to improve your mobility, and also to get better. Okay, so please do not worry about it. Is there anything else you would like to talk to me about?
Yeah, the doctor said that I can use some walking aids. You know, I can actually walk. Do I actually need to have those things, use those things?
Well, speaking about the walking aids, like the crutches and walking aids, it is important that you use it to reduce the strain on your injured leg. It will also promote your bone healing and gives you balanced mobility. So I understand that you can manage it by yourself right now without the walking aid. However, if you're not using it, there are high chances that you might fall down again. You might slip, you might lose your balance. That can lead to further injuries and complications. We don't want that to happen for you. So it is better that you use the walking aids if at all you have to mobilize. Okay. So please, I hope it is clear to you.
Yeah, it does.
All right. So do you have any questions for me?
No, nothing.
All right. So it is to be noted that before you return to your daily activities, you have to remember it is going to be a very gradual return, so it can take some time. So you need to avoid any strenuous activities in the initial phases. Just because you're discharged, that does not mean that you can start doing all the exercises or all the activities by yourself. Give yourself some time, recover fast. And remember that you need to be not wearing, it is important that you come for the follow-up checkup as well. Okay? All right. So it is important that you have follow-up checkups.
So, Richard, I'll send out your 5 minutes. Thank you.
Thank you. Alright everyone, welcome back. So I hope all of you witnessed the entire role play presentation, got an idea about how this can be done and how the task can be organized and set. So yes, good evening all of you. Yes, Suma, good evening. Yes, very happy to have you back also. Yes, Dinsha, good evening. Adura, good evening. Yes, I hope all of you are staying safe and healthy and your preparation is going well as well. So yes, coming to this card, you can see the card here. This is an orthopedic ward. So this is a point which I would like to repeat again and again because I usually don't promote students to make a decision whether you are dealing with a known case or an unknown case by just looking at this setting which is given, because it can vary. Okay, we cannot predict or rely on this setting to be giving you an idea about whether this is a known case or an unknown case. You need to read the background information following that or just given below that. So now, speaking about what situations, we can understand from the given data that the patient is already at the hospital and we would have the details of the patient available with us or maybe at the hospital. So that means this is a known case. So in certain settings, it is okay to be judging or concluding that this is going to be a known case by looking at the setting. Okay, but if it is an emergency department or if it is a hospital or if it is given as a clinic, community health center, you need to be reading your background detail also to understand whether there is any examination that was taken place or not. If there is an examination taken place, that becomes a known case. If there is nothing like that, that becomes an unknown case. Now, in this context, we don't have to worry about it because we know the patient is physically present at the hospital, being admitted there. So we will definitely have the data of the patient available with us. So that makes it a known case. Now, when you know the case is known, the next thing you need to be identifying is which category of known case it is, whether it is a first category known case or a second category known case. Now, it is important that you have an idea about what is first category known case and second category known case. So please let me know in the comment section. Those who know it, please type and let me know what you mean by first category. Okay, Suma has commented in the background it shows your patient is a known case or first category case. Excellent. So could you also tell me why it is a first category? It's a known case and why it is a first category, or rather please explain to me what is a first category known case. So others who are not familiar about this concept will be able to understand the context. Suma, congratulations, and I'm very happy for your score. So happy that you attained that score. Okay, very, very happy for you. Congratulations. Yes, what do you mean by the first category known case? Yes, anyone? What is your understanding? So if you guys don't know what is a first category known case, let me know in the comment section. I don't mind explaining that again. So if you're watching the live for the first time, or if you have no idea about what is a first category and how to identify a first category, that's completely fine. Just let me know in the comment section. If you don't know it, I can take you through that. Okay, I'll give you a few seconds to reply for that. Yes. What is your understanding of this context? What is a first category? Okay, so Adra has mentioned first category means we didn't talk previously with this patient Excellent. Yes. So that means we know this patient, we know the details of the patient, but you never had any previous communication with this patient. That means this is the first time you are talking with this particular patient. So that is what is called first category noun case. So the exact opposite of this will be the second category noun case. That means it could be a second time talking to the patient, more than second time or 2 times that you're talking to the patient. So maybe the patient was under your care for a couple of days. It is your routine visit. These type of information will tell you this is a second time in conversation. So that makes it a little more easier for you to understand which type of introduction you need to be selecting for the context. Okay, because the introduction varies for first category and second category, because if it is a first time conversation, it is important that you greet, you say who you are, you verify the patient details because it's the first time you're talking to this person, and then you state the reason for the visit and proceed with the task. But if it is a routine visit, or if the patient knows you back, you don't have to say who you are again, or you don't need to verify the details of the patient, because we know the patient there, the patient knows you back also, so you can skip all these points. So this will definitely help you to draft your intro part. Therefore, it is very important that you have an idea about how to identify first category, second category to plan the proper start. Okay, yes. So Suma is saying she got 380 for the speaking, and so first attempt. Oh, very happy for you. Congratulations. All your hard work paid off. Again, I know that you've been watching the live and being in the speaking club for a very long time. Like, you've been constantly been there, taking part in the sentence construction. You always try to improve yourself, the sentences, listen to the mistakes. The next time you rectify it and you remember the points. So all your hard work paid off, Suma. Congratulations. Very, very happy for you. So yes. So she has mentioned from the background, it shows it's non-case. First category means already the patient is non, but no communication with the patient. Absolutely right. So that is what is called first category. Now, since we know this is a first category non-case, let's look at the intro part. We need to greet. We need the self-introduction, we need to verify the patient details, and then proceed with the task. Okay, this is the step, or these are the steps you need to remember when you are dealing with first category noun cases. Edikana points are greeting, self-introduction, verification of the patient, and the task, reason for visit. Okay, now this has to be memorized, this has to be literally learned by all of you, and understand that, okay, if this is my context, these are the steps I need to use for my intro part. Be very clear with it. Do not have any confusions. You need to be very clear with it. Okay, so now in this particular context, I have shown in the role play mock test that I have greeted the patient, and after that I have said my name, I verified the details of the patient, and then I said why I'm here and proceeded with the task. Okay, so when I say why I'm here, basically I'm doing task number 1 because that is my reason for the visit, pre-discharge discussion with the patient. So that is how you will coordinate your introduction in this context. Okay, just let's rewind that and get understanding. You need to understand whether a case is non-case or unknown case. Now, if you know it is a non-case, you need to find out whether it is first category non-case or second category non-case. Now, once you know it is a first category, this is your these are the steps you need to incorporate. Greet, self-introduction, verify patient details, state the reason for the visit, proceed with your task. Okay, now in this particular context, I'm just going like this. Good evening, my name is Richa. I'm one of the registered nurses working in this orthopedic ward. For my verification, could you please state your name and age? Thank you for the confirmation. I'm here as advised by your doctor to discuss your pre-discharge details, or discuss the discharge details with you. So how do you feel right now, or how have you been feeling lately? So these are the questions I can ask to complete my task number 1. When the patient says, I'm not feeling good and things like that, I'm having this pain, you're going to reassure, that's your next task, reassure about healing process. Bone healing is natural, it can take time, body's amazing ability to repair itself. So I have to make the patient understand this is going to take some time in really polite and sensitive words. So let's see how we can do that. Now, if you have listened to the role play presentation, I have used if it gives any peace of mind as the sentence expansion for the word reassure. So for those who know it, I'm sure you guys do not find any difficulty to understand the usage of that word or phrase in the speaking. But for those who don't know, reassure എന്ന് പറയുന്ന ഒരു ആക്ഷൻ വെർബിന് ആ ഒരു ആക്ഷനെ നമുക്ക് എക്സ്പാൻഡ് ചെയ്യാനായിട്ട് ഒരു ഫ്രേസ്, ഓക്കെ, ദാറ്റ് ഫ്രേസ് ഇസ് കോൾഡ് ഇഫ് ഇറ്റ് ഗീവ്സ് യു എനി പീസ് ഓഫ് മൈൻഡ്. Listen carefully, take the notes. Do not miss out even an article from this point, because if so, the meaning will be changed, and the usage of idioms are pretty tricky. If you're not using it right or correctly or accurate manner, it will backfire. So make sure you catch it right. So it is if it gives you any peace of mind. I reassure you that. Okay, instead of if it gives you any peace of mind, you can even try if it's any consolation. If it's any consolation, this is also a good usage that you can try instead of if it gives you any peace of mind. So please take a note of it, and it is important that you try to use some sentences and phrases like this to show your proficiency level. But I won't say you need to overuse it, because too much of anything can be a little bad, too many cooks spoil the broth. So it is important that you have a well balanced usage of that. So keep it as an understanding, and make sure that you're using it very naturally. It shouldn't sound like you're struggling to use that as well. Okay, so what I would say is, first understand the sentence. First make sure that you're having the muscle practices to pronounce each words correctly and say it out. So read aloud. ഒരു അത് എഴുതി വെച്ചിട്ട് ഒരു 3 4 5 തവണയൊക്കെ അതിങ്ങനെ പറയുക, ഉറക്കെ വായിച്ച് പ്രാക്ടീസ് ചെയ്യുക. So make sure that you're very flexible to pronounce each of these words, and then try to construct some statements as you're reassuring the patient with this one. The more you practice, the more flexible you become, and it will get very easier for you. You'll become a natural. Okay, it will be very natural for you. So trust me, make sure that you try to incorporate it. It shouldn't be sounding like you are fixing there something very evidently. ഭയങ്കര എവിഡൻ്റ് ആയിട്ട് ഞാൻ ഇത് കഷ്ടപ്പെട്ട് ഇവിടെ വെക്കുകയാണെന്ന് തോന്നുന്ന പോലെ സൗണ്ട് ചെയ്യരുത്. It has to blend in. It has to be sounding very natural. Okay, so please be careful about that. Now, after you have said these statements like if it gives you any peace of mind, I reassure you that the healing process is going to take a little bit of time, because bone healing is natural, and please be advised the body's amazing ability to repair itself. Alangly, please remember your body has got good ability or amazing ability to repair itself. However, it is to be noted it can take some time because the bones heal naturally. Okay, or unlike any other injury, bone healing can take some time. These are all different sentences you can use. Okay, it's not strict that it is not mandatory that you have to stick on with one way of sentence construction, or this is the only way of constructing a statement. അങ്ങനെയൊന്നുമില്ല. ഈ ഒരു രീതിയിലേ പറയാവൂ, ഇങ്ങനെ മാത്രമേ സംസാരിക്കാവൂ, ആ രീതി പറഞ്ഞാലേ സ്കോർ കിട്ടൂ. No. Okay, it's all about your presence of mind. It's all about your sentence quality. It's all about your deliverance of that sentence. So make sure that you are familiar with the concept and you have some go-to statements which blend in with the sentence constructions, and it sounds very natural. നിങ്ങൾ സംസാരിക്കുന്ന ഒരു കാര്യം ഒത്തിരി എഫേർട്ട് ഇടാതെ നിങ്ങൾക്ക് ഇങ്ങനെ ആലോചിച്ച് തപ്പി പിടിച്ച് പറയേണ്ട പോലെ സൗണ്ട് ചെയ്യാത്ത രീതിയിൽ നിങ്ങൾക്ക് പറയാൻ സാധിച്ചാൽ, well and good, that will be a beautiful presentation. And also remember, you can actually say one sentence in different ways. Okay, വേദനയുണ്ടോ എന്ന്, do you have pain? Do you experience pain? Are you under pain? Is it painful? Do you experience any discomfort? പല രീതിയിൽ അത് ചോദിക്കാം. ഓക്കെ, ഇതെല്ലാത്തിനും ഒരൊറ്റ മീനിങ് ആണ് വരുന്നത്. സോ ദാറ്റ് ഈസ് ദ ബ്യൂട്ടി ഓഫ് ഇംഗ്ലീഷ്. When it comes to this particular language, you can construct that one sentence or one topic in different ways. അപ്പോൾ ഞാനിപ്പോൾ ഒരു സെൻറ്റൻസ് ഈ ടാസ്ക് ഇങ്ങനെ ചെയ്യാം എന്ന് പറഞ്ഞാൽ അത് തന്നെ നിങ്ങൾ കാണാതെ പഠിക്കണം എന്നൊരു നിർബന്ധവുമില്ല. വാട്ട് എവർ സെൻറ്റൻസസ് ഐ എം ടെല്ലിങ് യു ഈസ് ഫോർ യുവർ റെഫറൻസ്. You can note it down and you can understand, okay, this is how it can be said, or this is one way of doing it. Let me find an easiest way. Or if you are very happy with the statement that I'm giving, yes, you can memorize it. But I'm not a fan of memorizing, because if you forget one point, you will get stuck. പിന്നെ ആ വാക്ക് ഓർമ്മ കിട്ടി അതവിടെ പറയാൻ പറ്റിയതിന് ശേഷം മാത്രമേ നമുക്ക് മുന്നോട്ട് പോകാൻ സാധിക്കുള്ളൂ. അതുവരെ നമ്മളവിടെ സ്റ്റക്കായി പോകും. സോ ദാറ്റ് ഇസ് നോട്ട് No, a wise thing to do. So I recommend you guys to understand the meaning and use the sentences I'm giving you as a reference and understand it. Try to create your own statements, simple, convenient ones for you to speak. Okay. Now, coming to the point, once you have constructed the statement, you have a question to ask, which is find out any concerns or questions. So the common mistake I have seen students asking here is, do you have any other concerns? Now, there is nothing grammatically wrong with the statement. The statement is absolutely correct based on the grammar, but when it comes to logic, it isn't right because you have used the word other in this question. Do you have any other concerns? Even when the patient did not ask you even one concern, ഒരു കൺസേൺ പോലും ചോദിക്കാത്ത ഒരാളോട് ഇനി നിങ്ങൾക്ക് വേറെ എന്തെങ്കിലും കൺസേൺ ഉണ്ടോ എന്ന് ചോദിക്കുന്നതിൽ ലോജിക്കലി കറക്റ്റ് ആണോ? അല്ല. പേഷ്യൻ്റ് ഒരു കൺസേൺ എങ്കിലും ചോദിച്ചിട്ടാണ് നിങ്ങളത് ചോദിക്കുന്നതെങ്കിൽ ഓക്കെ. ഇവിടെ പേഷ്യൻ്റ് അങ്ങനത്തെ കൺസേൺ ഒന്നും തന്നെ ചോദിച്ചിട്ടില്ല. ഓക്കെ, സോ പ്ലീസ് മേക്ക് ഷുവർ ദാറ്റ് യു ഡോണ്ട് ആസ്ക് ദ ക്വസ്റ്റ്യൻ ഡു യു ഹാവ് എനി അതർ കൺസേൺസ് right at the beginning of the role play. You can do it maybe towards the mid portion or towards the second last task or last task of your role play. Avadeyokke your usage is absolutely perfect, accurate, fitting aanu ningalku adu use cheyyam. Adallade edeyil aadyamokke it is not the best thing to do. Okay, so please make sure that you do not repeat the same mistake, because I have seen a lot of students repeating the same thing over and over again. It's kind of like a habitual thing aanu, so please make sure that you are taking care of it. Now, once you've asked this question, the patient will ask you like, why do I need this cast and things like that. So you're going to explain the patient the need of cast or splint. So it helps for immobilization, for healing. That means the patient needs to be keeping the hand without much, the leg which are without much movement. It has to be set like that itself for a faster recovery. So you can explain that point. You can use the same words which you can see here. You can say it will help for, it will help to immobilize yourself for a quicker recovery, and it will help to keep the bone aligned and prevent further injury. And then next point is also provide guidance on hygiene. Or അടുത്ത explanatory point ആയതുകൊണ്ട് ഞാൻ role play ചെയ്തപ്പോൾ I used the phrase having said that. Okay, you can take note of all these phrases and you can use it as the connection points to the next point too. So when you have to connect two explanatory tasks together, it is advisable that you use something like having said that, that being said, moving on, now, all right. ഇങ്ങനത്തെ വാക്കുകളൊക്കെ യൂസ് ചെയ്താൽ കുറച്ചുകൂടെ ട്രാൻസിഷൻ സ്മൂത്ത് ആണ്. Okay, so keep that in mind. So here what I used is having said that. If I'm not wrong, if I recall it correctly, I think I said having said that. Having said that, I would like to give you some advice on hygiene and personal care with the cast. Please keep it dry. I'm not saying anything else. I'm just adding the word please in front of keep it dry. And do not stick anything inside to scratch. Okay, so that പിന്നെ ഞാനത് യൂസ് ചെയ്തൊരു point, the patient already asked me about the cast, like it is very itchy, is it necessary that I need to wear this എന്നൊരു question ചോദിച്ചിട്ടുള്ളത് കൊണ്ട് തന്നെ ഞാൻ തിരിച്ചു പറഞ്ഞു, ആൻഡ് യു ടോൾഡ് മീ ഇറ്റ് ഈസ് ഇച്ചി, സോ പ്ലീസ് ഡു നോട്ട് സ്റ്റിക്ക് ഇറ്റ് എന്നുള്ള രീതിയിൽ അത് കണക്ട് ചെയ്തു പറഞ്ഞു, വിച്ച് ഈസ് ഓപ്ഷണൽ but it is also good because you have a criterion called understanding and incorporating patient's perspective. Understanding and incorporating patient's perspective is a criterion that comes under clinical communication criteria. അതിൽ സെക്കൻഡ് പോയിൻ്റാണ് ഞാനിപ്പോൾ പറഞ്ഞിട്ടുള്ള ക്രൈറ്റീരിയൻ. ഈ ക്രൈറ്റീരിയനിൽ അവർ കൃത്യമായി പറയുന്നുണ്ട് പേഷ്യൻറ്റിൻ്റെ ക്യൂസ് പിക്കപ്പ് ചെയ്യുക, പേഷ്യൻറ്റ് തന്നിട്ടുള്ള ഇൻഫർമേഷൻ വെച്ചിട്ട് അവരുടെ പോയിൻ്റ് ഓഫ് വ്യൂ മനസ്സിലാക്കുക, തിരിച്ച് ഫ്ലെക്സിബിൾ സൊല്യൂഷൻസ് കൊടുക്കാം. ഓക്കെ, സോ അപ്പോൾ ഇവിടെ പേഷ്യൻ്റ് ഓൾറെഡി പറഞ്ഞു എനിക്ക് ഇച്ചിയാണ് എന്ന് പറഞ്ഞപ്പോൾ ആ ഇൻഫർമേഷൻ ഞാൻ കേട്ടുവെന്നും അത് ഇൻകോപ്പറേറ്റ് ചെയ്ത് ഞാൻ തിരിച്ചൊരു ഡയലോഗ് പറയുമ്പോൾ ഐ ആം ഗെറ്റിംഗ് സ്കോർ ഫോർ ദാറ്റ് പർട്ടിക്കുലർ ക്രൈറ്റീരിയൻ. ദിസ് ഇസ് ഹൗ ഇറ്റ് വർക്ക്സ്. ഓക്കെ, സോ ഓരോ ക്രൈറ്റീരിയൻ്റെ ഇമ്പോർട്ടൻസ് മനസ്സിലാക്കുക, അത് എവിടെ എങ്ങനെ എന്ത് പറയുമ്പോൾ എപ്പോൾ പറയുമ്പോൾ സ്കോർ കിട്ടും എന്ന് മനസ്സിലാക്കുക. ഈ ഒരു കാൽക്കുലേഷനിൽ ചെയ്യുകയാണെങ്കിൽ യു വിൽ ഡെഫിനറ്റ്ലി get a B score without much effort. It's going to be super easy for you. It's going to be super understanding for you. So please make sure that you remember these points. Okay, so in this context the patient already told me the patient is having a lot of itchiness and he doesn't want to wear the splint or the cast. So I'm going to say, well, I understand that is really itchy for you, but please do not stick anything inside ennolla point paraam. And please look for any signs of skin breakdown. If you notice any, please make sure to contact us immediately, or please inform the authority, inform immediately ennokka parayan ketto. And once it is done, you can ask the question, so is that okay with you? Will that be okay with you? Is that something that you can do? I hope you will take care of it എന്നുള്ള രീതിയിലേക്ക് നിങ്ങൾക്ക് എന്തെങ്കിലും ഒരു ക്വസ്റ്റ്യൻ സ്യൂട്ടബിൾ ആയിട്ട് ചോദിക്കാം. The patient says yes. So next point is describe pain management options. So ഇവിടെ you can interact because a patient does really need to ask you a question. ഇനിയിപ്പോൾ ചോദിച്ചില്ല, നമ്മളങ്ങനെ ക്വസ്റ്റ്യൻ ചോദിച്ചിട്ടും പേഷ്യൻ്റ് പറഞ്ഞില്ല എന്നുണ്ടെങ്കിൽ you can say, well, I have another topic to discuss with you. It's about the pain management എന്നൊക്കെ തന്നെ പറയാം. It's not necessary എപ്പോഴും പേഷ്യൻ്റ് തന്നെ പറയണമെന്നല്ല. But remember one point. It has to be like ഒരു 3:2 പ്രൊപ്പോർഷനിൽ വേണം നിങ്ങൾ 5 മിനിറ്റ്സ് നോക്കാൻ. ഒരു 3 മിനിറ്റ്സ് ഒക്കെ തന്നെ നിങ്ങൾ ഒറ്റയ്ക്ക് തന്നെ സംസാരിക്കുക. ഒരു 2 മിനിറ്റ്സ് ഓഫ് ഇൻട്രാക്ഷൻ എങ്കിലും വേണം എന്നൊരു കാര്യം നിങ്ങൾ ശ്രദ്ധിക്കുക. കാരണം അത് 2-way കമ്മ്യൂണിക്കേഷനാണ്. ദർ ഹാസ് ടു ബി സംതിങ് കോൾഡ് ആസ് ഇൻട്രാക്റ്റീവ് കമ്മ്യൂണിക്കേഷൻ. അപ്പോൾ എവിടെ പേഷ്യൻറ്റിനെ ഇൻക്ലൂഡ് ചെയ്യണം, പേഷ്യൻറ്റിനോട് എപ്പോൾ ചോദ്യം ചോദിക്കണം എന്നുള്ള കാര്യങ്ങളൊക്കെ നിങ്ങൾ എന്ത് ചെയ്യുക, ഒന്ന് പ്രീ പ്ലാൻ ചെയ്യുന്നത് നല്ലതായിരിക്കും. ദ ട്രാൻസിഷൻ എവിടെ വേണം, എങ്ങനെയാണ് ആ പോയിന്റ് പറയുന്നത്, പേഷ്യൻറ്റിനെ കൊണ്ട് ചോദിപ്പിക്കണോ, ഈ പോയിന്റുകളൊക്കെ തന്നെ ശ്രദ്ധിച്ച് ചെയ്യുന്നത് ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ആൻഡ് also to help in your transitions too. So remember these points, okay? So even I'm planning to do it like, ask a question like, is there anything you would like to ask me? So the patient is asking me regarding the pain management. So you can say, well, about this pain management, or speaking of the pain management, the doctor has prescribed some medications for you, so please continue it. Apply ice packs and keep your leg elevated. These strategies will definitely help you to feel better. In addition to this, there are some other strategies like gentle toe movement and relaxation techniques. ഇവിടെ റിലാക്സേഷൻ ടെക്നിക്സ് എന്നുള്ള ഇൻഫർമേഷൻ ഇല്ലാത്തത് കൊണ്ട് what I did in the role play is to give information like hospital physiotherapist will be seeing you before your discharge. Enough, that's fine. നിങ്ങൾ അവിടെ എന്ത് നോളജ് പറഞ്ഞു കൊടുത്തു എന്നുള്ളതല്ല, നിങ്ങൾ ആ സിറ്റുവേഷൻ എങ്ങനെ കമ്മ്യൂണിക്കേറ്റ് ചെയ്തു എന്നുള്ളതല്ല ഇമ്പോർട്ടൻറ്റ്. അപ്പോൾ അവിടെ എന്ത് പറഞ്ഞാൽ മതി, നിങ്ങൾക്കറിയില്ല അവിടെ എന്ത് ഇലാബറേറ്റ് ചെയ്യണം. So what you can do is you can simply say the hospital physiotherapist will be seeing you soon to discuss the exercises and what are the things you need to do to improve your mobility and your movement എന്ന് പറയുമ്പോൾ ആ ഒരു പോയിന്റ് അവിടെ കംപ്ലീറ്റ് ആയി. And then you can ask again, so is there anything else you would like to ask me? Okay, so these are the different points that you need to keep in mind. I hope it's clear. Alright, if you have any questions, feel free to ask me, okay? So if it's clear, please let me know in the comment section you're following me. If it's not clear, please let me know you're not following me also, okay? Alright, so that's with that task. The next one is advise importance of using crutches, walking aids. So in the previous point, since I already interacted with the patient, do you have any concerns? I'm not going to repeat the same thing for the next transition because I don't want the repetition to be happening. So what I can do is I can use a connector. Instead of interacting, I can choose to move on to the next point by myself. I can ask, say a sentence like, okay, so moving on, I would like to talk to you about the importance of using crutches. Enough. That's fine. So make sure that you have a proper organization technique in place. Where to interact, where to ask a question to transit, where to use connectors for the transition. You need to have an idea because this is your communication, this is your conversation. You need to be having that idea about what's to be done, how to be done, and things like that. Okay, so remember to keep these points in mind. Now, the next point is advise the importance of using crutches, walking aids, reduces strain on injured leg, bone healing, balance, mobility, etc. Okay, so this is a pretty easy task. So let's see how we can do it. Mr. George, it is important that you use crutches or walking aids to reduce strain on injured leg, improve your bone healing and your mobility, or to balance your mobility. And please remember, when you return to daily activities, it has to be a gradual return and you avoid strenuous activities initially, and full weight bearing can only be done after the follow-up checkup. So I hope it's clear to you. So the patient will ask me, is it necessary I have to come for the follow-up checkups? So you can say, well, it is important that you come for your follow-up checkups so that we can monitor your healing progress. We can do the cast and split adjustments if any, and take x-rays if needed. It is really important for a full recovery. So make sure that you come for the regular follow-up and checkups. This is how you can explain that point too. Okay, so when the patient says, yeah, that's okay, I'll take care of it. So the next thing you can explain is, okay, I hope everything is clear to you. You got an understanding about how to take care of yourself, how to look after you after the discharge. So is there anything else I can help you with? The patient says, no, nothing else. I understood all the points. So you can wind up. So you can say, thank you very much for your time and patience. So please keep in mind and please follow the instructions as mentioned by the doctor and given by me, or given by us, or follow the instructions. And the general given the instructions. And after that, you can say, so please take rest. If you need anything, please ring the buzzer. That is one conclusion you can say. Or you can say, please take rest, Mr. David or Mr. George. The hospital physiotherapist will be here soon to discuss the exercises with you. So please be relaxed. Please take rest. In the meantime, if you need anything, feel free to ring the buzzer. Wind up. As I told you yesterday, in the live conclusions, if there is any extra activity that is to be taken place after you finish these points, like clinical evaluation or examination or suture removal or cast removal, activity activity wind up. Okay, so shall I start with the clinical observation? The patient says yes, and you can say thank you. That's it. You don't have to say thank you for your time, I'll take care, I'll talk to you next time. അങ്ങനെ പറയേണ്ട ആവശ്യമില്ല, കാരണം ആ കോൺവെർസേഷൻ അവിടെ തീരുന്നില്ല. നമ്മുടെ റോൾ പ്ലേ കഴിഞ്ഞു, but the conversation in real life has not yet ended. It has to go on. It is getting to the next level of conversation. So that is how you have to deal with the situations for conclusions. Conclusions ചെയ്യുമ്പോൾ ഒരു വേറെ ഒരു ആക്ടിവിറ്റി അതിനകത്ത് പറയുന്നുണ്ടെങ്കിൽ ആ ആക്ടിവിറ്റിയിലേക്ക് പോവുക. അങ്ങനെ ആക്ടിവിറ്റി തന്നിട്ടില്ല എന്നുണ്ടെങ്കിൽ you can wind up like a normal completely close-ended kind of like a conversation. Okay, so that is with this entire communication. I hope you got an idea about how this card can be done, and I hope you got an idea about how the sentences can be constructed. So please rewind to the mock test part and see how the sentences were said, the reassuring statements, the transition points, like a note here. And whenever you are given a chance to do the one-to-one sessions, try to incorporate these sentences, the phrases, the connective points and things into your role play and see whether you can balance it out. So these are the points that you need to keep in mind and practice. So that's all for today. I hope everything is clear to you guys. Thank you very much for your active participation and for listening to me. So I'll be back next Tuesday with another role play card discussion, and on Wednesdays we'll be having mock test presentations. Okay, so stay tuned everyone. If you have any suggestions or recommendations on any topic to be done or selected for the discussion, remember to post it as a comment in the comment section. I will go through it and I can pick it up if you need to discuss. Okay, so yes, thank you everyone. I'll be coming back next week. Until then, take care. Good night.